Hey there, my friend. I'm really happy you're here with me today. Now, if you're in your 50s, 60s, 70s, or even past 80 and you deal with things like your vision getting weaker, needing to use the bathroom more often, or feeling uncomfortable when you do, that tingling or numbness you get in your hands and feet, your legs feeling weak when you get up or walk around, that aching pain you feel on the inside of your knees, and that wobbly, unsteady feeling where you feel like you might lose your balance. You know what I'm talking about. These kinds of changes that come with age can make the simplest things, getting up from a chair, sitting back down, walking through your own house, or even stepping outside, feel like they completely drain you. If any of that sounds familiar, then I made this video for you specifically. Here's the thing. As we get older, our bodies naturally start losing muscle mass and strength. There's actually a name for it. It's called sarcopenia. On top of that, the cartilage in our knee joint starts to break down, our tendons and ligaments lose their flexibility, and because we tend to move around less, our blood circulation gets worse too. All of that together makes it harder to move the way we used to, and it makes the legs feel more uncomfortable and tired. Now, when you hear all of that, you might think, well, that's just getting old. There's nothing I can really do about it. Might as well just accept it and move on. But that mindset is completely wrong, my friend. I truly want you to understand that feeling healthier, stronger, and more capable is absolutely possible at any age. We do not have to feel like we're slowly fading away. And today I'm going to walk you through 4 simple exercises that can genuinely make a real difference. Here's what they are. First, sit to stand, which is basically practicing moving from sitting to standing up, and it helps build strength in your legs and makes everyday movement easier. Second, partial chair squats. These are gentle half squats where you use the chair to safely strengthen the muscles in your thighs and your glutes. Third, standing heel raises, where you rise up onto your toes to strengthen the muscles in your lower legs and help keep your ankles stable. And fourth, single leg balance with a chair, where you stand on one leg at a time while using the chair for support, and this one helps improve your balance and lowers your risk of falling. These exercises are simple enough that after hearing them explained just one time, you can follow right along. You don't need any fancy equipment because I put these together specifically with older adults in mind. You can do all of them right in your own home. But please hear me on this. Don't treat these like some kind of miracle cure. Don't stop taking your medication because of them, and don't expect to feel completely transformed after just a couple of sessions. Real, lasting results only come when you stick with it and do them consistently every single day. If you tend to forget, feel free to follow my channel. I put out gentle exercises made just for people like you, with clear step-by-step instructions every time. All right, are you ready? Let's get started. Ready? Our first exercise is sit to stand. Like the name says, it's simply the motion of going from sitting down to standing up. This one is about as straightforward as it gets. All you need is a sturdy chair with a backrest, and you can do it right there in your living room. No extra equipment, nothing to buy. I'll walk you through it step by step, nice and slow. Start by sitting up tall in the chair. Keep your back straight, your feet about shoulder width apart, and point your toes out just slightly. Your hands can rest gently on your thighs or just hang naturally at your sides. Take a breath in, and then as you breathe out, press through your thighs and hips and rise up to a full standing position. Once you're standing, keep your back tall, let your shoulders relax, and look straight ahead. Pause there for a second or two until you feel steady. Then slowly lower yourself back down by bending at your hips and knees, bringing yourself back to the chair in a controlled and careful way. Do this 8 to 12 times depending on how you're feeling that day. Each rep only takes about 10 to 15 seconds, and even though it looks easy, don't sell it short. While you're doing it, you'll actually feel your thighs and glutes working. This is the same movement we do dozens of times throughout the day without even thinking about it, getting up from the dinner table, off the couch, or from the toilet. Research in the field of geriatrics shows that this exercise builds strength in the legs and hips, improves your balance, brings down your risk of falling, and gives you more confidence when you're moving around. After a few weeks of doing this regularly, A lot of people find that standing up feels easier. Their legs don't get as tired, and getting through the day feels a whole lot lighter. Now, if something feels off while you're doing it, it usually comes down to a few common habits: leaning too far forward, pushing hard off the chair with your hands, or popping up too fast so your knees crack. Any of those things can take away from the benefits and throw off your balance. So remember, slow and controlled the whole way through. There's no rush. Great job. Now let's move into the second exercise, and that's partial chair squats. This one is also very safe and easy to do at home. You're still using the same chair, nothing else needed. Sit up tall on the edge of the chair this time, with your feet about shoulder width apart or just a little wider, toes pointed outward somewhere between 15 and 30 degrees so your knees feel comfortable. Hands resting lightly on your thighs or hanging at your sides. Breathe in, and as you breathe out, push your hips back and gently lower yourself down like you're about to sit deeper into the chair, but only go down about a third to halfway. Keep your back straight and make sure your knees are tracking right over your toes. Then press through your thighs and glutes to push yourself back up to where you started. Do this 8 to 12 times, taking about 4 to 6 seconds for each up and down movement. When you're doing it right, you'll feel the front and back of your thighs and your glutes really engaging. Your back stays naturally straight, shoulders relaxed, no hunching forward, and your knees move in line with your toes instead of caving in. The mistakes to watch out for are leaning too far forward, letting your knees collapse inward or flare out too much, or dropping down fast and then bouncing back up. Those habits put uneven stress on your knees and make the exercise a lot less effective. Keep it slow and keep it controlled. Some people might look at this and think it's too basic to actually do anything. But I promise you, partial chair squats work the large muscle groups in your legs and hips in a way that's gentle but genuinely effective. Studies in geriatrics back this up. They help fight the muscle loss that comes with aging, and they improve your ability to walk, go upstairs, or stand for longer without wearing out. A lot of older adults who do these consistently say their legs feel steadier and that the tingling and aching in their knees goes down over time. It's a simple exercise, but the results speak for themselves. Just do it every day. Wonderful. Now let's go to the third exercise, standing heel raises. This one focuses on the lower part of your legs, and it's very gentle. You just need to stand next to your chair in case you need something to hold on to. Stand up tall with your feet shoulder width apart and flat on the floor. Place your hands lightly on the back or sides of the chair, but don't grip it hard. Breathe in, and as you breathe out, slowly rise up onto the balls of your feet as high as you comfortably can, lifting your whole body upward. Hold that position for 2 to 3 seconds and feel your calf muscles doing the work. Then, keep breathing out and slowly lower your heels back to the floor. Don't let them drop. Bring them down with control. Do this 10 to 15 times at a slow and steady pace. When you're doing it correctly, you'll feel your calves engaging clearly. Your body stays upright the whole time without tilting forward or backward. Your shoulders are relaxed. Your knees are almost straight but not locked stiff, and your heels go straight up and come straight back down without wobbling side to side. The mistakes to avoid are leaning too far forward, locking your knees out completely, or shooting up and dropping back down quickly. Those things reduce the benefit and can put extra strain on your ankles and lower back. Always slow, always controlled, always upright. And if you don't feel steady today, that's completely fine. Just rise up a little bit. You don't have to go all the way up. Then as your legs get stronger over time, you can gradually go higher. The reason I included this one is because your calf muscles do a lot more than people realize. They play a big role in your balance, and they're what help push your body forward when you walk, stand up, or climb stairs. Research in geriatrics shows that this exercise builds calf strength and endurance, improves stability in the ankles, lowers your fall risk, and helps blood circulate better through your lower legs. A lot of people notice after regular practice that their legs feel more solid, that tingling in the feet starts to ease up, and walking just feels lighter overall. All right, if you've made it through those first 3, you're doing an amazing job. Now let's finish up with the fourth and final exercise for today. Single leg balance with a chair. This one is all about improving your balance, building your confidence when you move around, and lowering your chances of taking a fall. Stand tall next to a sturdy chair with your feet about shoulder width apart. Place one hand lightly on the back or side of the chair for support, and let your other hand hang at your side or rest on your hip. Take a breath in, and as you breathe out, shift your weight onto one leg, whichever one you want to start with. Then slowly lift the other foot off the floor, just about 2 to 4 inches, keeping that knee softly bent. Hold that position for 5 to 10 seconds while keeping your body tall, shoulders relaxed, and your eyes looking straight forward. Then slowly set that foot back down, return to standing on both feet, rest for 2 to 3 seconds, and then switch to the other side. Do this 5 to 8 times on each leg depending on how you feel. When you're doing it right, you'll feel your core and your hips gently working to keep you steady. The leg you're standing on stays straight without the knee being locked. You won't be gripping the chair for dear life. Your body stays upright without leaning to one side, and your breathing stays calm and relaxed. If you feel like your balance isn't quite there yet, just lift your foot an inch or two off the floor and only hold for 3 to 5 seconds. With regular practice, you'll notice you feel much more stable, your posture improves, and walking starts to feel easier and more natural. So, why does this exercise work so well? Because it sharpens your body's sense of where your joints are in space, it strengthens the stabilizing muscles in your hips and core, and it trains the part of your nervous system that's responsible for keeping you balanced. And those are the 4 exercises. I spent a lot of time researching and putting these together specifically for you. They're not magic. You won't wake up feeling like a completely different person after just a few days. The real key is doing them consistently, every single day. Over time, they will gradually help your body get back to better balance and strength. And if you have any doubts or concerns before starting, please talk to your doctor or do a little more research first. That's always the smart move. If this was helpful to you, I'd really appreciate a like on the video, and please share it with someone else who might benefit from it. The more people we can reach, the better.